on Friday, where are we, August 28th, 2020. Another beautiful day in downtown Boonville, 75 degrees. Nothing from Hurricane Laura yet, although we had a cloudburst yesterday when I was teaching. So that was kind of fascinating. Just came out of nowhere, wasn't predicted. What we're going to talk about today is the microbiome of the human body, specifically the gut, and we're going to talk about the gut-brain axis, and also discuss the imbalances that occur that can lead to all kinds of health issues, actually about 40 of them. And I'll give you a list of them near the end, and I'll teach you how to get your gut health back into shape. Some of it's eating, some of it's supplements, but this has become a hot topic probably over the last 7 years. One of the health coaches I know in Chicago, that is her specialty, functional medicine health coaching for gut health. And I have nutritionists, etc., that I can refer to or have you interact with if it's something you want to delve into deeper. So really the gut, and so we teach in physiology anatomy, of course, we teach the anatomy of the intestines and the brain and the enteric nervous system. So your intestines really have kind of a second brain. They have a nervous system. I guess you have a nervous system throughout your body, but this one's actually pretty active. So that it's a bidirectional communication device between your brain and what's going on in your intestines. And so by bidirectional, I'm talking about signals that are going back and forth between what's going on in your intestine and what's going on in your brain. And actually they found recently that if your gut microbiome is out of whack or imbalanced, it affects your mental health status, specifically depression and anxiety. And actually childhood behavior has been associated with imbalances of gut health as well. So let's plug into it. So we're basically talking about regenerating your gut health. So there's ways to do that. Some of them natural, well, all of them natural actually, since we're going to talk about some supplements as well. So it's pretty well recognized that the gastrointestinal tract has a large amount of microorganisms. Okay, so I put in the little teaser for this class that you're made up of about 37 trillion cells. You're carrying 3 times that amount of bacteria. So it can be bacteria, it can be fungi, it can be parasites, it can be viruses. And if those are all in balance, you're pretty much healthy. Once they get out of balance, that's when you start having some illnesses and diseases. So it's an enormous microbiome. So there's microbiota, which is the actual bacteria or other microorganism. The microbiome refers to the actual bacteria or microorganism plus its DNA and genes. Okay, so this microbiome, and you have this, I mean, I showed you on a little picture on the teaser for this, that you really have a microbiome throughout your whole body. So, you know, the axilla, the inguinal groin area, your mouth, your nose, your ears, all carry microorganisms. We're specifically focused on the gut ones, the intestinal ones today. So what does it mean? Why is it a big deal? So it's a diverse array. It's bacteria, it's fungi, it's protozoa, it's viruses found in all mammals. You get colonized within 2 or 3 days after birth. So newborns, newborns have to be colonized in order to remain healthy. Okay, so that starts pretty much right after birth. You're kind of insulated by your mom until you're born. And then they found that breastfeeding is part of the immunity and the building up of immune response for newborns. So breastfeeding, we'll talk about this later. I've got a list of 10 ways to improve your microbiome. Okay, so these are physiologic organisms that positively impact your health. So it involves energy and equilibrium, metabolism in general, so they help you break down the food that you eat, health of the gut lining, immunity and boosting immunity, as well as neurobehavioral development. Okay, so it's almost, I mean, if you think, so we taught yesterday there's 11 organ systems in the body, the largest being the integumentary system, or the skin. Well, if your 37 trillion cells make you up, you have 100 trillion microorganisms. So some people think of that as like the 12th organ, or a microbial organ of the body, because of all the physiologic and pathophysiologic, so patho means illness, interactions with the rest of the body. So less diverse microbiomes, you have to have diversity. So I said over 1,000 species. If you have less diversity, that's associated with, or possibly causative of, about 40 medical conditions, including allergies and mood disorders, autism, digestive disease, and irritable bowel syndrome, inflammatory bowel syndrome, heart and cardiovascular ailments, and some cancers. So I'll give you that list here in a little bit. So basically, if you get pathologic pathogens or presentations of abnormal microorganisms, that usually comes about in about 3 different ways. So one, you can get a body-wide illness, like when you're sick with viral illness and the flu or the coronavirus. Okay, and then there can be focal and concentrated introduction of abnormal microorganisms in your body. So think about periodontal disease, gum inflammation, infected teeth, infected tonsils, and so that usually forms an abscess. So it's a type of abscess. It's a focal point. And then there's chronic pathogen colonization, which is kind of what we're going to talk about today. And that is less focal. It's an area of overgrowth of imbalanced microbiome. So again, we're talking about the gut today, but that's all over your body. So it's less concentrated compared to a focal infection. Okay, and they continue to replicate. Okay, so you basically have a biofilm protective barrier from your gut microbiome to help keep you from getting over-colonized with abnormal pathogens. Okay, so everybody knows about focal infections and body-wide infections and abscesses, etc., etc. However, chronic pathogen colonization has been found in mucosal linings, so the oral cavity, the lungs, throughout the GI tract, and it's sort of starting to be recognized as a condition that has a fair amount of clinical importance. Okay, it's pretty common. There's not technically a test. I mean, there is a fecal test that you can do for certain organisms, but checking your gut microbiome is kind of difficult. So you just kind of have to keep it into a healthy arena, and there's ways to do that. So probiotics. I don't know how many of you all take probiotics. Good morning, Wendy. But probiotics, and then there's prebiotics. So there's the type of food you eat, and we'll talk about that with my little list of 10 things. So prebiotics help probiotics, like lactobacilli, that's the one most people have heard of, that's in yogurt, and bifidobacteria. You need a probiotic that has a combination to help feed and take hold in a recolonizing gut. Okay, so most of the time, you start. One of the things that frequently happens is people get an illness, they get an antibiotic, and of course, antibiotics change your gut flora, so your microbiome is altered. Okay, so think about every time that you take an antibiotic, which only works for bacteria. A lot of people kind of push their doctor around. They say, oh, just give me an antibiotic, give me a Z-Pak, whatever, for an upper respiratory infection, most of which are viral. There's no evidence that antibiotics help with viral infections. And what we're seeing over the last 20 years is resistance to antibiotics by pathogens. They know how to figure out how to change their DNA and their structure to avoid antibiotics. I've had 2 patients that I gave in the past that I gave 1 dose of methoxin. One was for a young lady who had a fairly significant obstetrical tear at vaginal delivery that I had to repair. I gave her 1 dose of methoxin, and she got a Clostridium difficile infection throughout her bowel, which we then had to deal with. And then I had a 27-year-old woman in Oklahoma who had ovarian abscesses, so she had pelvic inflammatory disease, and we had to take her ovaries out. She'd never been pregnant, and she wound up with a Clostridium difficile infection that overtook her body. So Clostridium, C. difficile, you've heard that, can actually be cardiac toxic, and she died of cardiac toxicity at age 27. Just from IV antibiotic treatment for a fairly fulminant pelvic inflammatory disease. I mean, 27-year-olds, 27-year-olds don't typically have to have hysterectomies and ovaries removed because of pelvic infection, but hers was overwhelming, and we could not get on top of it, even though we did pretty radical surgery on her. And then the antibiotics that we treated her with gave her a C. diff overgrowth, which attacked her heart. So probiotics, if you take an antibiotic, and I'm not saying you shouldn't take an antibiotic because there are good reasons for antibiotics, but it will change your gut microbiome. And so a probiotic recolonization of the gut after antibiotics seems to make sense. Most of us that do this take probiotics pretty much every day. The other thing is an important factor, and I don't know how many people do this, is tongue hygiene. So remember the oral cavity, I mean everything's coming in basically through your mouth. And so you're trying to eliminate seeding of new pathogens by tongue hygiene. I'm sure your dentist has told you to floss, okay? They may not tell you about brushing your tongue, but when you brush your teeth, you should brush your tongue, because inside those little crevices in your tongue grow these bacteria, and if you don't take care of the hygiene of your tongue, you're swallowing them. Okay, so plenty of people have overgrown tongues, and most people that have chronic pathogen colonization anywhere else in their GI tract also have abnormal tongue microbes on the surface. So there's a heavy biofilm on a tongue. There's an array of anaerobic bacteria, viruses, fungi, protozoa on the tongue. Chronic impacted and rotting food particles. So if you don't brush your teeth and you go to sleep and you get up and that morning breath is really from pathogens of the from the food that you've eaten and some of the food that's probably still in your mouth. So your tongue really has no way of naturally getting rid of those overgrowths. Okay. So if you have a thick tongue coating, and anybody watching this is probably run to the mirror and look at their tongue. If you have a thick overgrown film on your tongue, that's been associated with an elevated serum C-reactive protein level. And C-reactive protein is a measure of total body inflammation. There's a high sensitivity C-reactive protein specifically for the heart, or inflammation around the heart. C-reactive protein by itself is a marker of inflammation, just like fibrinogen. Okay, so colonization on a chronically coated tongue may cause body-wide increased oxidative stress based on an elevated CRP level. So oxidative stress, we've talked about free radicals and oxygen reactive species. That's what we're talking about, is oxidative stress. So you have to remove that film. So they make tongue scrapers, right? And so you should technically, when you brush your teeth, which you should do after every meal, that's what the dentists say, right? or before you go to bed, first thing in the morning, you want to scrape your tongue first, and then brush your teeth, and then brush your tongue. Okay, so a lot of times if you take care of that, if you have halitosis, bad breath, you can eliminate that just doing that. And then remember, we talked about hydrogen peroxide. So you can put a little hydrogen peroxide in your mouth, let it foam up, and spit it out instead of swallowing it. Hydrogen peroxide is the body's natural antibiotic. So they think that overgrown tongue growth of microbes is a leading factor in the sequence of chronic pathogen colonization. Okay, so you have to do that type of tongue and mouth hygiene to avoid swallowing all these things that you're eating. Well, if you're eating, you're gonna swallow it, but food particles that sit in there and basically give you bad breath. That is pathologic bacteria that's growing. There's a health coach here in New Franklin whose sister was in my class last year, and one of the things that she tells everybody is the very first thing in the morning you should do your tongue hygiene even before you have your coffee. Okay, so you got that film on your teeth, that's bacteria and microorganisms, and that yucky taste in your mouth and all that. This health coach tells people to do your daily oral hygiene regimen as soon as you get up, before you even drink coffee. Okay. All right. The other way that you can do it is nebulization. We talked about hydrogen peroxide, another, breathing that into your lungs with a nebulizer, or even a spray bottle at 3%, and you can dilute that if that's irritating to you. So nebulization is a pretty routine way of administering medications, like for asthma and bronchoconstriction and COPD. So what you're doing is moistening inhaled air to promote mobilization and expulsion of mucus and secretions. Okay, so that's kind of how it works. Okay, and then it allows a direct contact of an anti-pathogenic agent with areas of colonization in your alimentary tract. Okay, and so it's a way to attack and break up those biofilms that may be pathologic. Okay, so there's really no perfect or consistent or totally effective way to do that. So we're talking about scraping your tongue, brushing your teeth, flossing, all that. So two substances that seem to strip away those biofilms that are pathologic are DMSO and hydrogen peroxide. So DMSO usually invokes terror when people think about DMSO. I've used it for chronic interstitial cystitis in women with a little heparin and some lidocaine. Very effective for women that have chronic pelvic pain associated with cystitis. So you nebulize with hydrogen peroxide at 1 to 5 cc's of 3%, bringing the volume up to a total of about 10 cc's. So 3% hydrogen peroxide mixed with 10 to 12 cc's of distilled water, and then you use 1 to 5 cc's of that mixture in a nebulizer. And you do that for about 15 minutes. That is basically the same thing I told you about breathing into your lungs to help the natural antibacterial or bactericidal effect of hydrogen peroxide. You can also mix DMSO, so I'll tell you this little deal. You can mix DMSO with vitamin C and magnesium chloride, and that combination is effective in clearing pathologic biofilms and underlying pathogenic colonies. So that is 1 to 5 cc's of 99.9% DMSO mixed with 10 to 12 cc's of distilled water and a solution of vitamin C and magnesium chloride. So the concentration isn't that important. So you basically put 2 teaspoons of sodium ascorbate vitamin C powder and 2 teaspoons of magnesium chloride powder to about a half a cup of water. Vitamin C will oxidize over time, so you have to use it it'll turn yellow. You have to use it almost immediately. Or you can make it separate from magnesium chloride solution, which doesn't oxidize, and then make your vitamin C solution right before you're going to nebulize. So fairly simple little things. So probiotics, nebulized hydrogen peroxide or DMSO with vitamin C and magnesium chloride, and oral hygiene will impact the gut microbiome in a positive manner. Okay? It's possible that you combine those and you get synergy, which means working together as opposed to an additive effect. So they may actually work better if you do a combination of what we're talking about. Okay? So, what are the diseases associated with unhealthy gastrointestinal pathogens? So there's leaky gut, and that's a controversial term. Not everybody believes in leaky gut, specifically gastroenterologists a lot of times. But leaky gut syndrome, if there is such a thing, and there's plenty of data both sides. There's no such thing. There's really a thing as leaky gut, but it's a foundation for, since we're talking about the microbiome, it's the foundation for a lot of the diseases and illnesses that have been associated with an imbalanced microbiome. So there's general impairment of immune function. It's been associated with breast cancer, pancreatic cancer, colorectal cancer, associated with metabolic syndrome, which is prediabetes, or insulin resistance, which leads to weight gain, heart disease and heart failure, hypertension, gestational diabetes. So 10% of pregnant women have a form of diabetes that usually goes away with delivery. There have been pregnancy complications associated with the gut imbalance, allergic diseases, allergies to food, intolerance to food, autoimmune thyroid disease, polycystic ovary syndrome, migraine headaches, depression, autism, abnormal mental health in adolescence, decreased cognitive function and memory, so Parkinson's disease and neurodegenerative disease like Alzheimer's in general, stroke and other central nervous system problems, irritable bowel, inflammatory bowel symptoms and disease, abnormal bile acid profiles, liver disease, bacterial vaginosis, which is way more common in women for vaginitis than yeast infection, like by a factor of 10. Most of the women that had vaginal discharge and vaginitis had bacterial vaginosis, not yeast. Diabetes, abnormal lipid profiles, juvenile arthritis, generalized osteoarthritis, rheumatic disease, gastrointestinal conditions of any kind, pulmonary fibrosis, interstitial lung disease, COPD, asthma, cystic fibrosis, eye disease, periodontitis and gingivitis, and then that pathogen colonization that we talked about in the GI tract, abnormal gut microbiome from antibiotic exposure, obesity, and weight gain. So that's about 40 things that an abnormal gut microbiome will give you. So how do you fix it? How do you get it healthy? Okay, so I'm going to put you up a list when I get done. So number one, eat a diverse range of foods. Okay, so the more different kind of foods that you eat, the better your gut health will be. Okay, so there are certain regions of the world where they have a better microbiome just because of the way they eat. It is not the Western diet of standard American diet, what's known as SAD. So it's usually greater, the microbiome is greater in people from rural Africa and South America, as opposed to Europe and the United States. So the diversity of food is important, and of course, like your mother said, eat your vegetables, eat your fruit. So eat lots of vegetables, legumes, beans, and fruit. Okay, so raspberries, artichokes, green peas, broccoli, chickpeas, lentils, any kind of beans, kidney, pinto, white, whole grains, Apples, artichokes, blueberries, almonds, and pistachios increase bifidobacteria in human beings. Okay, so that's a probiotic that promotes the growth of beneficial gut bacteria. Okay, fermented foods. So this list is gross to me, except for yogurt. So that's pretty easy to take. Kimchi, sauerkraut, tempeh. Those are some of the fermented foods that can benefit your gut health. And so, and yogurt, most people know about yogurt, right? Um, I've had women that have chronic bacterial vaginosis eat plain yogurt mainly because it helps with their intestinal microbiome. And so the end part of the alimentary canal is the anus, awfully close to the vaginal opening. And then women can put plain yogurt in the vagina, mainly for the pH. So the pH of the vagina is 4.5 to 5. Yogurt has the same pH. It does have lactobacilli, and vaginas need lactobacilli to keep them from getting bacterial overgrowth. You don't really colonize the vagina with yogurt, colonize the vagina with lactobacilli by putting yogurt in it. You're resetting the pH. So a simple vaginal hygiene health approach to that. Avoid sugar, of course, and avoid artificial sweeteners. So aspartame may reduce weight gain, although I debunked that about 6 months ago. But it also increases blood sugar and impairs insulin response, even though it's not technically a sugar. Stevia is a sugar. You don't absorb stevia. That's the benefit of stevia, is you don't really, you get the sweet taste, but you don't absorb it into your body. Okay, and then prebiotic foods. So basically, fiber and complex carbohydrates, they cannot be broken down and digested by human cells. So they have to be digested by bacteria, usually in the colon. So they go all the way through to the colon, specifically resistant starches. Okay, so they can be prebiotic. They're not absorbed in the small intestine. They have to be absorbed in the large intestine, where the microbiota of the large intestine breaks that down. Okay, breastfeeding for new moms. 6 months of breastfeeding has been recommended for years, but specifically for this instance, to get a good microbiome for a newborn. Whole grains are part of the dietary recommendation for the microbiome. So they're non-digestible carbs, and they promote beneficial bacterial growth within the gut. Okay, a plant-based diet. And I always tell people that there's a lot of things that you cannot get if you are a vegan and plant-based, but you can get a good gut health from that. You're missing a whole lot of things that that you can get from animal products, but you can also take supplements. So if animal eating isn't your thing, there's a way to supplement what you're missing from animal products. Okay, foods rich in polyphenols. Okay, they have a lot of health benefits. They reduce blood pressure, inflammation, cholesterol levels, which to me is not that big of a deal, and oxidative stress. So polyphenols also cannot frequently be digested. So we're talking about cocoa and dark chocolate. Dark chocolate is, there's a friend of mine that eats dark chocolate all the time, every day. So the dark chocolate, if you get a sweet tooth, dark chocolate is actually beneficial to you. Red wine, grape skins, green tea, we've talked about green tea before, almonds, onions, blueberries, and broccoli. Okay, and then take a probiotic supplement. So if you don't like eating that way, you can get what you need from a probiotic, and I'll put you up a list, and I've got a protocol on FullScript that I wrote specifically for this when I started doing this, or thinking about doing this for class today. So I put that together. I'll put a link up to that. I'll put you some, I might make a separate post with the probiotics that I've found that are pharmaceutical grade. They are developed by practitioners. So that's the thingy on gut health. Does seem to help with anxiety, so there's the gut-brain axis, and we'll develop that a little bit more at a different class. The Art of Floundering podcast for the health and wellness series last night was a big hit. We talked about sexual health and went through a whole bunch of interactions with people watching us, and it was a fun episode. So I think sexual health is going to probably go on for a few weeks. So a panel of health experts. We added a new one yesterday or last night. So very well received. It's on YouTube, Art of Floundering Podcast. Go there and subscribe to it, and you'll get notified. And then I usually do a watch party. I think most of the members of the panel put a watch party on, so mine was on last night. So have a great day. Peace and health. I got to get ready for next week's lessons for State Fair Community College, but I do have 4 days to get ready for the next 3 classes. So y'all have a great weekend, and I'll talk to you Monday. See you later. Bye.